the blessing is, and I sometimes have to really convince myself of this, but the blessing is this is my gift. My brain is the perfect brain for me. This is my gift to the world because the fact that I get depressed has given me something that I can use to help other people who experience depression. And, specifically, I, as a woman physician, am really passionate about preventing physician loss to suicide. Some of our losses are because of the system. Some of our losses are because of sleep deprivation. Some of our losses are, people like me who, my whole purpose with Mind Surfer MD is to save one life. And if it's only my own, that's enough.
Please know that this discussion includes talk about depression, eating disorders, and suicidal ideation. We hope that we provided the information in a way that's helpful. However, the discussion should not be taken as medical advice. If you need immediate help, please seek professional support and consider using the references listed in the description below. Hello, everyone. Welcome back to the channel, or welcome to the channel if you're new here. I have an amazing guest who I love very dearly. We have Dr. Liz Treynor. She's a pathologist, and she is also the host of Mind Surfer MD. It's a podcast. So we're going to hear about her and where you can listen to this amazing podcast, which is about normalizing discussions on mental health and helping women physicians find their joy again. So, Dr. Treynor, thank you so much for joining me.
Oh, that's me. Please call me Liz. I even tell my lab staff, I'm like, oh, just call me Liz. I don't want them to be intimidated by me. But it is so much fun to be here, Jillian. When I saw your Kevin MD article, I'm like, she is my people. I love this woman. I need to connect with her and I need to have her on my podcast. And it's funny because we scheduled this interview last year and my brain was I've been saying lately, I have a fast twitch brain and a slow twitch brain because I consider myself mentally spiced. And so my brain is bipolar, if you want to use psychiatrist speak, bipolar light, bipolar 2. But I don't like to use that label. I don't feel like that's not who I am, right? That's my brain just works differently sometimes. And I don't like to use those labels. But when we spoke a year ago, I was so depressed. Now, I cried through our whole talk, and you were just so lovely. And you're like, it's okay, we don't have to record this. And when we broke up the class, and Zumba dance always helps me so much, but today, full circle, my brain is in its clear, fast twitch place, and I just finished my Zumba class, and it makes me so happy. So dancing with other people is like the best of all worlds. Connecting with people, music, laughing, moving, all that good stuff. But to get back to Mind Surfer MD, gosh, the journey there, I never, ever, ever dreamed that I would have a podcast, let alone go public, like internationally about my brain quirks. And I was inspired, number one, by Leveraging Growth Accelerators, which is a physician entrepreneurial group that Jillian and I are both in. And that's probably how I met you, actually, was through LGA. And number two, Empowering Women Physicians, which is a physician coaching program with Sunny Smith, which has also been transformative for me. And I just got back from a trip with Sunny and 67 other badass, amazing women physicians in Bora Bora, and this is my
Oh, gorgeous!
This is my stingray.
It's amazing.
We got to pet. We got to go snorkeling with stingrays and pet them and hold them, and it was amazing. But that was another transformative experience where I started to feel like I was saying this morning in our group in our closing call that I felt like I grew to just love myself and own my own voice and step into my full self, even though that includes, that includes both my slow twitch brain and my fast twitch brain. So there's sometimes when I'm so depressed and I'm not doing any podcasts and I'm not posting anything in my Mind Surfer MD Facebook community because My brain is in hibernation mode, and that's okay. And those days, I'm just trying to survive, honestly. Like I have my little goals every day to do a little journal, and my goal for today is survive. Just keep breathing. Getting out of bed is hard. I'm a functional depressive when my brain is slow twitch, meaning I still go to work. And in fact, it's healthy for me to go to work because being with other people is really important for me. And when people say, well, what helps you get over that period? The two things I say are time, like nothing helps. But when I think about it more, the other thing that helps is being forced to be with other humans because depression is so isolating.
Mhm.
And the isolation perpetuates it and makes the spiral go down and worse. It makes it worse. So hard to get out of bed. It's so hard to be in public. Yeah.
I was going to say, especially when we're left in a depressed state because it clouds our vision. And when you shared with me last time you met, it's like, I get it. And people ask, oh, what's your YouTube schedule? I'm like, I don't have one. It's to honor those downtimes. And it's honoring the rest and pushing yourself just the right amount to be in a light where you have hope. Because if we're thinking about ourselves to the dark cloud of depression and left alone to that, then that's what creates that perpetual cycle from my experience.
Yeah, absolutely. Yeah. And I'm so glad you also said you don't have a schedule because I used to say I'm a fake podcaster because I don't release at the same time every week.
We just
And it's, I'm like you. It's like I do it when my brain is ready and working and clear, and it's fun. Because when my brain slows down, I have panic attacks. Like I'm terrified. Like I just don't, it's not fun anymore. And the blessing and the curse is that I obviously would love to just be like this all the time.
Yeah.
It's so much more fun. And the blessing is, and I sometimes have to really convince myself of this, but the blessing is this is my gift. My brain is the perfect brain for me. This is my gift to the world because the fact that I get depressed has given me something that I can use to help other people who experience depression. And, specifically, I, as a woman physician, am really passionate about preventing physician loss to suicide. As you and I both know, we lose 2 medical schools classes, that's 400 physicians a year, to our own hands. And that breaks my heart. And for some cases, it's, the burnout, right? The moral injury of practicing medicine in our country. And for some of us, it's, an impulsive decision. There was a beautiful young radiologist mom who was so sleep deprived, and your article talked about the sleep deprivation and how that clouds our thinking. I mean, literally, we're drunk when we can't think, when we are sleep deprived. But this beautiful radiologist had 3 young kids, and earlier that day, she planned a fishing trip for next weekend. And the night before, she was telling her sister, "Oh, I don't want to be away from my son when I go on this, this trip." And the next day, impulsively, she lost her life because she was sleep deprived. And she had no history of mental illness. And so, some of our losses are because of the system. Some of our losses are because of sleep deprivation. Some of our losses are, people like me who, my whole purpose with Mind Surfer MD is to save one life. And if it's only my own, that's enough.
Wow. That was just
It's
so
really to save my own life. It's to save my own life. And if I can help one person with something that I am willing to say, because I think our willingness to be vulnerable and to talk about the challenges of depression in our lives helps us not feel so isolated. Because I think the most important thing, there's so many things we can do to help our brains feel more productive and more joy and more normal. But one of the things when our brains are just not working is to connect with other people. And by the stigma that we have stupidly, in my opinion, created around the fact that, what, something like 50 or more percent of physicians at some point in training have had suicidal ideation. Like, it's so common.
Yeah.
And in some states, we still risk losing our license. We risk losing our jobs if we seek help, if we seek counseling, if we speak publicly about it. And honestly, I was terrified to do this podcast, that I would lose my job, lose my license. And fortunately, California is one of the more progressive states where the licensing law is written in an ADA compliant way, whereas more states than not have ADA non-compliant medical licensing laws.
Wow.
And I have friends who have had to get piss tested. Like, if you are honest on that, have you ever had a mental illness? If you are honest, you will be put in a community of, I mean, we're all human. I'm not trying to label one better than the other, but you're considered basically a drug abuser. And you are piss tested. You are told what psychiatrist to go to. It's humiliating. It's unnecessary. And in other states, you lose your job. And you have to, this is something else I really, really want all of our physician listeners to know. This is so important. Never, ever sign a physician health plan. It's a PHP, and it's called something different in different states. But if your administration flags you as somebody who has depression or PTSD, they may hand you something that you think is going to be for your help. They're going to say, this is going to help you. You do not sign that. You call a lawyer right away. Okay, that is the takeaway from this talk today that I want every physician to know. Do not sign that paper and get a lawyer.
A couple of things that you said really resonated. When I was a surgical resident, for anyone who hasn't yet heard my story and how we connected, it was my article, I Risked My Career to Save My Life. And I actually titled it something different. It was about high functioning depression. And at that time I was in the military and I got help for my mental health. And I was medically discharged from the career I loved because surgery wasn't conducive with my well-being, but the military was everything to me. So when we're in that mental, I still remember my thoughts because I've had a journal.
Can I give you a Kleenex?
No, we're going to allow
Here's a Kleenex.
But a couple of things you said, right? You did your podcast to save your own life. When I was in surgery and in this sleep deprived state, my brain only thought I needed to continue in surgery or take my own life, because our society makes us feeling like leaving and being a quitter, you can't even show your face, that it's such a failure that you'd rather take your own life. So when people are trying to save their career at the risk of their life, at that moment, what they may feel is the inability to realize that that's a problem. Because the psychache I had at the time, the mental pain I had at the time, it felt like there was never going to be an end to that. And the disgrace of leaving, my life was over. And that's why we have so much going on right now about how I'm trying to tell people, like, do not put your worth in external validation, external achievements. It's very destabilizing and you lose touch with what really matters in your life and your worth, even if you change careers. So if they can ground themselves in their identity and who they are without their career, it's not to say don't work hard and devote yourself to your career. It's just don't put your worth into that, because it can be taken away at any time and then you're left with yourself. And you were sharing too about how you were developing a self-love this year. And last time we talked, there's so much when we have differences in how our brains work, our society talks about it in a way that makes us be more self-critical. But when we just switch, like, yeah, that's the way my brain works. Sometimes I get depressed and sometimes it's very much warranted. Our world has a lot of suffering right now. And if you're a sensitive person, you may not know why you're depressed, but you could be feeling the suffering of the people around you. And to honor that, like, wow, the greatest gift, I'm so sensitive and I can help people, but it's painful. And during those painful times, I need more rest, and I can't be exposed to everything coming in because I just can't be present when I need rest.
Yeah. Avoiding the news. That's actually a therapeutic for me. That's like one of the social prescriptions I have for myself is I don't listen to NPR. I don't watch the news. My husband will tell me if there's something I really need to know, but it really doesn't help my brain. It's part of my mental health regimen. Like I work out every day. This is my bike. I have my weights over there.
I
I
love it.
meditate every day. That's
Awesome.
my tilt table.
I love
I
that.
will like to meditate upside down. It's really fun. I love inversions. I do a ton of yoga. I love yoga. It's like a moving meditation,
Mm.
reconnecting with yourself. And as somebody who, loves to move, it's hard for me to stay still.
Yeah.
Yoga is a
We could
wonderful
have had
moving
a
meditation.
we could have had a walking chat here because I'm the same. We resonate
Yes.
so much on
Yes.
what works.
Walking.
We're walking. We'll have to record another one where we're actually together and moving because so I used to run compulsively. Now I run
Mhm.
mindfully, and it's become a much of a
Yeah,
healing
I love that.
journey.
I was a compulsive runner too. I ran not because it gave me joy. I ran because I hated myself.
Yep.
And I thought if I set records, I held the record at my boarding school for almost 30 years because I hated myself so much that I thought if I can do this, then I'm worthy.
Yep. I totally relate to that. And you can save a life by sharing your story. When I shared my story on Kevin MD, I had no expectation for it, but I had spent 5 years in isolation, guilt, and shame and was very ill. And I wrote the story because I'm like, I have to let this go because I saw it was perpetuating every aspect of my life. I had worked for free because I knew my self-worth was at zero. And why was it at zero? A long history of why, but when it comes to leaving surgery, like that was the straw that broke the camel's back. And I'm like, I can never recover from this, even though that's false. That's an illusion that our brain plays on us.
Our
And so
brains lie. Such a good liar.
yeah,
I will never believe my brain when it lies to me and says I shouldn't be here. I
yeah,
will never believe my brain when it lies to me.
yeah, it's hard in that moment. And I always think that
It's so hard.
we talk about we hear that people take their lives, and for me, I just want to touch base on like what experience, and not to trigger people, but when they're having deep psychic or something that it feels like for me, and see if you relate, but it's like my brain, it's not a headache, but it's like a severe pain and you just want it to go away. And I think people numb with all
It's like a
sorts of,
brain attack.
yeah, it's like a brain.
Yeah. Somebody said it's like a brain attack. It's like the heart attack. It's like somebody dies suddenly because their heart doesn't work. And an impulsive suicide is like a brain attack. Like, earlier that day she was fine, but then she just got into that narrow tunnel where there seemed no option. And, obviously I have, chronic brain attacks for months at a time. But yeah, it's like our brain just does not work. It's lying to us.
Yeah.
And being able to step out of that, for me, meditation is helpful too, because it pulls me out of, it sounds kind of woo-woo, but out of the illusion of what we experience on this plane,
Yeah.
This room, this body, this, all that's not who I am. It's the awareness watching my thoughts. I'm not my thoughts. I'm not my emotions. It's my awareness watching all that. And when I meditate, I'm able to kind of observe the lies. I don't know if that makes any sense, but
It does make sense.
meditation I find really helps.
Yeah. And for people
Yeah.
too, I think the cultivation of self-compassion, because often if people meditate without having grounded themselves on that, well, you can often be very self-critical in that space.
Oh, that's not good. Yeah.
In. So
yeah, self-compassion is key. Yeah. So yeah, I have heard recently, and I didn't even realize this, that meditation can actually be very traumatic for some people, and I had no idea. So please,
yeah,
consult your doctor right before you do that if you've had serious trauma, because some people, when they're left with their thoughts, I guess they can go into a very dark place, and so that actually could be worse for some people. But for me, it helps.
yeah.
So,
And I think just recognizing that when it comes up, breathing techniques, or when I was coaching, I started to do Byron Katie, the work. So things can.
I love her. Changed my life.
It's
Read Byron Katie, Loving What Is. One chapter changed my life.
Wow. And
Mhm.
but it's fascinating too, because at different
Yeah,
seasons of my life, it brings it up, and I kind of calibrate how much of that triggering nature of content I can take at one time, and then allow myself to digest through it and to understand where that comes from, and also be grounded on self-compassion. And that always to me sounded so fluffy. And so it's like, I don't want to be, because I thought you were talking about how running, it was like to beat yourself up and to prove your worth. Our society for so long has always taught you to exercise to get rid of calories. And I'm like, no, I just have to surround myself by people who love to exercise, or exercise for a different purpose.
I exercise because I exercise because it helps my brain. I don't care what I look like. It's for my brain.
And self-compassion is
Yeah,
important in order to exercise appropriately and in tune with your body, which can
yeah,
be challenging
yeah.
for people who have
Some of
heard,
us.
for people who are thinking, there's so much great content on your podcast. So before we get too far, I want to make sure that they have a way to know where to find you and where to subscribe to that podcast.
Oh, and thank you for reminding us. There's so many fun things to talk about, but I do have a podcast. It's on Apple Podcasts, and I think I made it go on other podcasts. I'm no expert, but it's definitely on Apple Podcasts, and it's Mind Surfer MD, 3 words, if you will, if you consider MD a word. But and then I also have a Facebook community, which is a private community, and so anything we talk about in there is private, but we have about 600 physicians in there, and I say it's for women physicians and for the people who love them. And so it's my husband's in there. Okay, he was like my first customer.
Oh, nice.
my
Love that.
daughter my daughter who also has struggled with some mental spice, and honestly, this is another suggestion. Like, she keeps me alive and I keep her alive. Like, we have a deal. That is not an option.
Mhm.
And when I am really, really, I know I will never do that. Because what happens, I think, with suicide is we think the suffering will end, but all we do is we push the suffering on everybody we love.
Yeah.
It's
Yeah.
not really an escape. It's not,
And
you know.
it's, when you were saying you're glad that you know what it's like to feel depressed and have those feelings, I also feel, I used to ask, like, why do I have this? What's wrong with me?
Right.
And
Right.
even anorexia, I had a really interesting relationship with it until I asked, what role does this serve in my life? What is this telling me? And seeing it from a different perspective. And it helps
Mhm.
us to identify, I say human, not robot, because our culture is becoming more in a line with everyone needing to be more robotic. We're going through the motions. So what did suicidal ideation tell me? Well, I value being human, being connected with humans, and helping people to learn what it means to be human and how to thrive. And so when we ask ourselves, well, how does the human thrive? Well, of course we're suffering, because it's not what we're doing. Right?
Right. I
Because
saw
when
this
we're,
great quote recently. Yeah, yeah, keep going, keep going. But
I
I
was
just,
going to
this is
say,
such good stuff, Jillian.
yeah, because it's not, if we are normal humans, well, then it's very natural to feel the way that we do in reaction to the circumstances that we're facing. It would have been abnormal for me to be thriving without sleep, nourishment, social interaction. I'm like, fortunately, I'm human, and that's why all those flags came up.
Yeah, yeah. So the quote that I was going to mention is something to the effect of, you can tell how toxic a culture is based on how they view rest, right? And in a healthy culture, they embrace the value of rest. And in toxic cultures, you have to burn out
Mm-hmm.
before you're allowed to rest. Yeah, like, which culture are we in?
Yeah, I
uh,
think that was
yeah,
Adam Grant, wasn't it? Adam Grant
I
said
don't
something.
know who said it, honestly.
I follow Adam
Yeah,
Grant. He's all about
who is Adam Grant?
Adam Grant. I think he's an organizational psychologist. I was looking for his book. It's Think Again is his book. He's teaching us to
Mm.
rethink, right? We've been taught all these things. Just like my first article I wrote was on BMI. I'm like, BMI, so we know, for people listening, medicine, like, do you ever question it?
Right.
And where it came from? Because for me, with a history of an eating disorder, it just caused a huge obstacle. So then it took me longer to get help. And when I got help, I was much sicker than I would have been had that never existed as an obstacle to my care. And if you look to where it comes, it's just an assurance. There's a lot of things wrong with the BMI and the use of the BMI. So
the BMI was an obstacle to your care.
Yeah, so there was a BMI number associated with a diagnosis of anorexia, but at the time I was diagnosed,
But you were like trying to get to that number or something.
In order to
Is
get
that what you're
help, I
saying?
had to. Yeah, and it doesn't make any sense.
God, that is so messed up.
It's a mental health condition.
Oh.
And all of our body types start at a different BMI. So it makes no rational sense for that to have ever been in a diagnostic criteria.
Unbelievable.
I was almost dead by the time I got help for it. And then I knew the number, and it's a numbers condition. So there's another diagnosis that they call atypical anorexia. The difference is it didn't meet weight criteria. And how invalidating is that for someone struggling?
I know. Like, I can't even do anorexia right. Ah!
That's exactly what,
Oh my
especially
God.
often very perfectionistic type A people that never feel seen. And it's been interesting. And I think the benefit of knowing that people will never understand, and what's the benefit of proving them like it's not their life anyway and they will never get it, it caused me to learn how to use, and I'd love to talk to you more about how you lean into your authentic voice, because when you understand all the judgments that we get from our society and you live in order to prove something to others, you just get further and further away from your relationship with yourself. And like, what value would that even have? Anytime I proved it, I was in the hospital. So it's not fun.
Yeah. Gosh. It's so funny you said that, because my high school yearbook quote was from Zen and the Art of Motorcycle Maintenance, which my coach, Charlie Bell, recommended to me. And something in that book that I used in my yearbook was, when you climb a mountain to try to prove how big you are, you almost never make it. It was something like, the joy is in the climb, noticing this leaf, or this insect. And, so it's so funny you said that, because I just had this crystal memory of that quote, which I haven't thought about in a long time. But yeah, but like when I'm fast twitch Liz, I don't care anymore. I just want to be myself. I say that life begins at 50, because it wasn't until, recently, 53, that I have kind of let go of, coloring my hair or wearing makeup. Okay, I admit I did get eyelash extensions last week. Like Kate Montgomery
cool.
inspired me. I wanted to try it.
That's awesome.
And they're super fun, because I hate makeup and I don't have to do anything. They're just like done. But yeah, it's like I don't care anymore. Like I wear scrubs to work now. I used to care so much about coordinating everything, and it's like it's so liberating being 50.
Yeah.
So,
and I feel too,
yeah.
we can do that. So I'll be 35 this year, and I kind of feel like I'm at that stage.
You're a baby.
But to hate ourselves. So here's the value of going through periods of self-hate. When you learn to love yourself and you spent all that energy learning to love yourself, I will never let someone take that away. So a year ago, I was allowing myself to be mistreated. I'm underpaid and undervalued at times. And I was like, why do I keep accepting this? Well, because I undervalue myself. Okay, well, I'm going to work on that. And then once you work on it, and this is why I'm so very adamant about people developing self-compassion, because it was like I put glasses on, develop self-compassion, and then I could see all the things I was tolerating. And once I no longer treated myself poorly, I no longer tolerated it from others. And you create boundaries. But if you feel that inner self-worth, then what are you tolerating from others? Because I'll say it definitely jeopardized my ability. Like if you said great things about me, I would not talk to you. I would like, oh my God, what I would think is she's going to find out the truth about me and never want to talk to me ever again. But I'm very much open and you're here. So that's great. but I thought because the people who don't like me are right. And so I would surround myself with them because my inner dialogue was so negative. And I'm sharing this because I know people do it. We are putting ourselves in relationships and work environments that we think we deserve. So question, what are you tolerating and what does that mean? And what do you have to do in order to develop that self-compassion, inner self-worth, and then change your environment and what's no longer working for you?
That's beautiful. Yeah, I related to that, um, like probably the three most painful events in my life were divorce. My husband, whom I still love, it's actually my husband. I'm remarried now. I have two husbands, but my husband left me for a family friend. It's the worst 5 years of my life. I was diagnosed with lymphoma during my surgical pathology fellowship at Stanford when I had a newborn who was 7 weeks premature and only 3 weeks old. So, and then the third one was getting my house burglarized. I was burglarized while I was in the divorce process. So I learned firsthand, you cannot count on people. I thought we would never get divorced. You cannot count on your health. I never thought I would have lymphoma at age 30. I it just it just was surreal. And I got to diagnose myself basically. I diagnosed somebody with the exact same thing that I had the week before, diffuse large B-cell primary mediastinal lymphoma. I met her in my support group. I met a lot of patients I had diagnosed in a month before in my support group at Stanford. And stuff. I lost they took everything, every piece of jewelry I owned, every single last one. And there was my former wedding ring, my some beautiful pieces that were lost. And so I learned things are temporary. So there's just me. And how liberating that was in the end, right? It was just me. That's
Yeah.
it.
Yeah. And liberating, I like that you use that word because we can put a lot of words, right? When I'm having down days, I feel some days when I'm feeling that profound loneliness, I know my thoughts. Like, of course, people can leave me. Anorexia is a hard, complex condition. And so for most of my adult years, I've lost relationships to it. And I said, of course they can leave me. I can't leave myself. So if I don't love me, I think that weighed heavily on me when I was getting discharged from the military and leaving surgery, right? Because I knew I was taking my brain with me. And at that time, I hadn't repaired my relationship with it. But it's so important what you just shared, right? And if we are alone, to feel how can it be liberating and exciting? And self-love definitely helps that rather than being like, well, I'm so lonely and life isn't worth living because I'm stuck with me, so completely different mindset shift and how much you live your life. And so I hear it in our coaching circles, like I have my own back, and I have just keep showing up. And I have one quote. I just lost an aunt to cancer. And I asked her at the end, I was like, how can I best support you? And she said, just be here. So we were talking over text. And I'm like, that's it. For ourselves during our dark days, we just have to be here. Just be here. When you're trying to help someone or even help yourself through something, it's just being present in that space and identifying what you need. Because I'm a problem solver, and I know that when people come to us sometimes, they don't want their problem to be solved. And same with me sometimes. I just want to like let it out and just like be in that space. But your presence and genuine presence is the most that people need at times.
So good. Yeah. And I love how you keep touching on self-compassion and how critical that is, such a fundamental part of enjoying life, really, because we all make mistakes, that's just part of learning, that's part of growing. And Kristen Neff obviously is she's got some great work out there on self-compassion, and part of it is recognizing the common humanity.
Yeah.
We all suffer. And that's part of the podcast, right? It's like just normalizing these conversations so that people can see the common humanity recognize we're not alone, because depression is so isolating.
Yeah.
Isolate ourselves and it gets worse. And so if we can have this conversation, then we recognize we're not alone, and then we can pull out of it, you know? But
Yeah.
yeah, but she talks about, how self-compassion is recognizing the common humanity. It's also mindfulness. Like, that's why I like the meditation. It's kind of like stepping out and saying, oh, my brain is thinking this, and oh, I'm observing and thinking I'm worthless. And is that true? Is that really true? Like trying to just observe and just trying to be present. Like something I find I really like to do when I'm very, very depressed is take pictures. I love iPhone photography.
Mm.
And I finally upgraded to iPhone 13, which has the macro lens, so I can take pictures of bugs, because I love taking pictures of bugs and flowers, because I'm so present and I literally and figuratively focused, right? I'm focusing the lens and I'm focusing my mind on something that is right in front of me. And so it takes me out of all the bullshit that's floating around in there. But mindfulness and common humanity and are some of those pieces of self-compassion. Yeah.
I
And
think,
there's a third one I can't think of right now.
yeah,
Self-love. I don't know. Can't remember.
Yeah, we'll put
Yeah.
Kristen Neff's links down below too. One thing that was hard is if we get the help we think is, we have an expectation that it's really going to help us and it doesn't. Okay, well, that to me, when I first got help for my suicidal ideation, wasn't very helpful. And I remember it was really harmful for me to have believed I had these really high expectations for where I was going and it didn't work out. And that's okay. Like, try again, just have the hope that there are different modalities, or people are going to help you.
There's so many more there are so many modalities. That's part of what my podcast is about, is like finding and introducing people to all these different modalities that you probably haven't even heard of.
Yeah.
Like like coaching was new to me. Like just this thought work, like how we can get in there and recognize, oh my God, if I think that makes me feel like crap. So do I really want to keep thinking that? Can I pick something different that serves me better? Right.
Yeah.
Like it's so hard and so easy, right? But there's so many tools out there. And I've started trying ketamine. My daughter actually was the one who said, my friend's dad is bipolar, and he really, really found ketamine that was the first time he could feel self-love. And so I'm like, you know what? I'm going to go find that. I'm going to go try it because I love my daughter. And so that's, there's so much research being done on psychedelics right now. And that's something else I really, really want to explore. And I'm going to do an interview with Dr. Teresa Anderson, who also works with treatment-resistant depression and talks about ketamine and other things. But there's so much out there, right? It's I really, really want our listeners to hear, our watchers, our viewers. I'm not used to YouTube. Our watchers, our viewers,
People listen.
you people.
People just listen. Yeah.
Right.
Say that they listen.
But I just want you, even if you feel like there's no hope, to know that there are so many resources that you don't even know exist yet. And I really would love for you to come, find my podcast, get out there. There's so many resources that you probably haven't even heard of yet. There's more that I don't even know. That's why I'm exploring. That's why I'm doing the podcast, to learn about other things like Reiki. Judith Hong is super cool doc who is somebody else that I've interviewed that I'll finally be releasing our interview. I actually interviewed her. She was my second interview, and I interviewed her a year and a half ago. And it's such a great interview. I thought it was such a bad interview because I got really depressed about the day after we did the interview. And I got so depressed. I thought, this is the worst interview ever. I really upset her. I need to shut down this whole podcast. And I finally got the courage to listen to it. It's actually a really good interview. And she finally got the courage to listen to it. And just yesterday said, yeah, that is a really good interview.
This we need to pause on this, because this happens to me a lot, where I'm like, oh my God, that was, the TEDx thing, right? I'm like, it was so awful. It's dreaded. I don't even want to show my face again. We get this vulnerability hangover.
Oh yeah. Oh, totally. I was like, oh, I said the stupidest thing at this moment. And it's like, no, you didn't.
Yeah. It's so fascinating.
It's okay. Right. How our brains, depending on where our fast twitch, slow twitch Liz, like, where am I? And that will completely color, right? It's like I either have my shit colored glasses, as
Mhm.
Melanie says, she's one of my coaches in
Oh yeah.
EWP. They either have the shit colored glasses when I'm really depressed. Or, I love my rose colored glasses. We gave these to all of our guests
Oh my
at
gosh. I
our
love
Princess
that.
Bride wedding.
That's
And so they
amazing.
have roses on them.
Wow.
And so everybody got a pair of rose colored glasses for
Oh
the
my
group
gosh.
picture.
That's awesome.
Yeah.
But
So,
it's so true. And I think there's an element of vulnerability hangover that all of us get sick to our stomach when maybe we pass on something, we said something, or you meet somebody new, right? Because I figure out I have a lot of anxiety. I love meeting people, but if I've never met them before, I'm just always more anxious. And then I'm like, oh, they're going to think I'm so stupid.
mhm,
And then the next day we have that hangover of whatever was said or wasn't said, or all the anxiety that we get leading up to the recording of a podcast or a YouTube video or submitting an article. I feel like it's very natural that if there was a lot of emotion and high anxiety, like for me, I always kind of have a crack. It's like that's a kind of natural kind of flow of, oh, you expended all of your
mhm,
energy doing that. And so the next day you feel like you're releasing it all. And it can make you just kind of
mhm.
take a step back from it. Don't edit it for a while. And yeah, I love what you did there and
Yeah.
sharing that experience.
Yeah. Yeah. No, I'm so glad I finally got the courage to listen to it. And I think it was Melanie who was like, okay, what's one small step? Because I was totally not, I'm like, I'm shutting down my podcast. All I do is embarrass myself. I am the worst interviewer. Who do I think I am? Right. Anybody could do this better than I do. Right. All those thoughts. And Melanie said, well, no wonder you haven't been working on your
Yeah,
podcast. You're thinking all that garbage.
I love Milady. She
Yeah.
helped me too.
She's so
Yeah.
good. She's so fun. She's so funny, so smart. She's so
Yeah.
incisive. She's like a surgeon getting in there in your brain. It's
Mhm.
like, what if you tweak that? And so she's like, well, what's one small action, right? It's all about tiny actions. Atomic Habits is such a good book. I'm sure you've many of you may be familiar with that, but it's like
Yeah.
just floss one tooth, just take one tiny action. I'm like, okay, fine. I will listen to the first 5 minutes of this interview I did a year and a half ago. And I'm like, oh, this is really good. And keep listening.
It's
So,
so it's amazing and how relatable that is. So many people are gonna share that they relate and just keep putting out there. Like for the video that I had, I'm like, okay, if I'm not proud of this, why should anyone else be? Why should anyone else want to watch this? Or if we go in thinking we suck, we're most likely not going to enjoy the process as much. The outcome is not going to be as good as we could make it. Like I find it
mhm,
amazing and very alluring when people just believe in themselves. And I'm like, I wish I could believe in myself, but I know that once we do believe in ourselves, we're going to be unstoppable because it's taken so long to get there and so much work to get there. And we know the alternative, right? You're like, well, that didn't work out too well when I didn't believe in myself. And I have my own back and I'm going
mhm.
to keep showing up. And we know too, and people are making comments. I always love Brene Brown. And she's like, are those people in the arena? I don't have a podcast. I have a YouTube channel, right? I don't know all the technology that goes into podcasts. I find it hard. Like, who are they to criticize you? And if they're going to criticize you, well, maybe it's just not the podcast for them. There's going to be people who mental health stuff is not their
Exactly.
thing. But we need to provide that space because it's life-saving. And there are people who are craving it and they need to feel that they're not alone. So the value you're offering, and I find that when we know our why, then we can overcome those hurdles so much easier.
Exactly. Exactly. This
Yeah.
is so good, Jillian. But on your birthday last year, I'd heard this quote for the first time. It was a Mark Twain quote. The two most important days of our lives are the day we are born and the day we figure out why.
I love that quote.
And I wrote you that day and I said, I feel like I'm your twin sister because today's the day I figured out why I was born.
Oh, wow.
Because my mission is to help other physicians survive suicidal ideation. That is my mission. That's why I'm here. So,
Yeah. And I think these
anyway,
discussions are so, it's going to be challenging, I think, for some to hear, but I think we hear the statistics. And I often don't hear people talking about it in a way that's helpful. Like, here's kind of a snapshot of what I was experiencing, and here are my next steps in order to save my own life. right? It's you shared,
Yeah.
it's trying to find the community and creating the community that you need.
Yeah. Calling one friend, like having a person that you will never hurt that way in your mind, in my mind, intercepting that brain that's just lying to you.
Giving ourselves permission and options. I found that to be very relieving of the mental anxiety or the mental pain I was having, because I was feeling that sense of being trapped. But if you give yourself alternative options that you genuinely will explore, it's a release. It can be a release of the mind. And like, I'm not trapped. There are other options. And we often resist that because we think, what if? And I hear it a lot as a coach. What are people going to think about me? Whose life is this? Right? Whose life is it? People are always going to think a lot about what I do or what I don't do.
Exactly. They're always going to think something. So might as well do what gives our lives meaning and joy, right? And if I can help one person, like I said, it's all worth it. One of the interviews I did was with Dr. Mona Massoud, who's the founder of the psychiatrist of the Physician Support Line, which is free, anonymous psychiatrist staff, Monday through Friday. Call. It doesn't matter. Whatever it is going on, call. The Physician Coach Support Line, very similar, founded by Diana Landano. I've also interviewed her. I haven't gotten around to publishing that yet, Diana, but similar, free, anonymous support from physician life-trained coaches. There are resources out there.
And I think hope is the ultimate, like you just need a little bit glimpse of hope. When I was reading about how to protect myself, like in those minds, it was releasing yourself of feeling like a burden. You're not. You might feel like you are, you're not. And hope and optimize your living situation as a human in a world that is continually being made more and more for robots.
And reclaim your common humanity, because this is part of the human existence. We all hurt, we all suffer. It's part of being alive. And then the challenge is to survive that, right? And use that to grow. And ultimately, for me, if you've ever read Viktor Frankl, Man's Search for Meaning, he talks about, how he survived the Holocaust because he had this driving mission that I need to share with the world how our brains work in adversity and how, when we can create meaning from our suffering, it transmutes the suffering. And so for me, doing this podcast is creating meaning from my suffering, because if I can, like I said, if I can help one person, that gives me deep joy. If I can help one person think differently.
Well, thank you for this lovely discussion. It's very meaningful, and I deeply appreciate you being here. We're going to put all the contact information in the show notes, and we appreciate anyone, if you have comments or you have questions, or if they want to reach out to you, do they find your Facebook group, or is there another way that is best to reach out to you?
Well, my Facebook group is probably a great way to do it. Again, it's Mind Surfer MD, but you can also DM me. I'm on Facebook, just Liz Treynor, just the way it's spelled on my screen. I'm the only one.
Perfect.
So
I love it.
Find me.
So I'm just going to prolong the exit as long as possible. But I want to thank everyone for
so much
being
fun.
here.
But I really have to pee. I have to pee.
So bye.
Nature calls. Bye, everybody. Thanks, Jillian. Love you.